Hey, welcome back. You know, over 20 million people in the United States suffer from painful, debilitating peripheral neuropathy. We've got Dr. Jeremy Wilson with us, Superior Health, Integrative Health, and of course, Doc, you're going to straighten us out on this. You don't have to have surgery or addictive drugs if you suffer from neuropathy.
Correct. Neuropathy is one of the degenerative processes that we see in our office quite a bit. A lot of people, they don't want to go down the road of drugs. A lot of times once the drugs wear off, the symptoms come right back.
Sure.
They don't want to go down the road of surgery, and so they're looking for healthy, natural, regenerative options.
Well, what is the peripheral neuropathy? Is that different from normal?
Is there regular neuropathy and then peripheral?
Yeah, I mean, peripheral is just basically, you're noticing symptoms out in your fingertips, your toes, your feet, your hands. And so you'll see numbness, tingling, burning. The biggest thing that we see is a lot of patients, they're scared that they don't want to fall over.
Right.
They don't want to lose their balance. Yeah. And then also they want to still be able to get out and drive their vehicles. Mm-hmm. And if they can't feel their feet, they can't balance, they can't drive.
Sure. Well, other things are cramping, hypersensitivity, right?
Yeah.
Kind of pins and needle pricking feelings like you got a little roach bug crawling on you.
Well, I think it's interesting when you ask someone, you know, what does your neuropathy feel like? And it's very, very hard to describe. What does my neuropathy feel like? Because, yeah, it could be extreme burning when you go to bed at night. Mm-hmm. It could be just, I can't feel my feet. It's like my feet are on pillows, is what a lot of people will say. Yeah. Like, I just can't feel it. And so one of the biggest thing is coming up with the proper diagnosis. Is that truly what you have going on? And then two, coming up with a treatment plan that, again, is natural and will give you long-term benefits versus just maybe, say, covering up your symptoms with medications or possibly even surgeries.
Well, you're in 3 different places, Spartanburg, Greenville, and Malden.
Correct.
How does someone know if you do, in fact, have neuropathy versus, I don't know what's wrong with you, but it ain't neuropathy?
Sure. So a lot of people, they'll self-diagnose. You know, they go on Google.
Google diagnose.
Exactly. Yeah. And so it's, you know, numbness, tingling, burning. I have those sensations. I think that's what I have. Our office, we have a simple 3-minute test where we can actually run a system through their hands and their feet, non-invasive, and in literally 3 minutes we can tell you, is this truly neuropathy and how severe is it? And is this something that needs to be addressed right now? And again, we can also tell you the awesome options that we have now with regenerative medicine.
Could you catch it so late you don't have any help for some people? So a sense of time.
Sure. I mean, there's obviously a case where, you know, a lot of times it's too far gone. The body can only heal and repair so much before it's just so damaged. But a lot of the people that we run into, I mean, if they're still walking in the doors, if they're still moving and able, there's still a chance that those people can get better and get results, for sure.
And then what are some of the ways that you do treat at your office?
Yeah, one of the best cutting edge things that we just brought on was something called Wharton's Jelly. It's a regenerative medicine product. And it's really amazing because it has all the tools, all the things that you need to repair a damaged, degenerated area. And so it's very similar to what these people call as stem cell therapies, in that they use the Wharton's Jelly from the umbilical cord. And it's jam-packed full of growth factors, all the things that you would need to repair a damaged area like your feet or in your hands when the nerves are just literally falling apart. That's what we could use the Wharton's Jelly for.
So it comes from your patient?
Well, it comes from
yeah, not from you. It wouldn't come from you.
No.
We don't have your umbilical cord. Yeah, but yeah. So does it rub on? Is it injected?
You can inject it into the joints and into the feet. Yeah.
Wow, that's great.
Yeah. And the great thing is that it's also covered by a lot of the insurances are starting to pick up this stuff, so people aren't having to, you know, take a loan out and $10,000 to go get this stuff done. So that's the great thing is we're working with people's insurance and trying to meet people where they're at, you know, and really with our team approach, we have multiple providers in each location, so we can look at every little aspect of your health and make sure that we're addressing everything when it comes to your neuropathy.
So if someone's watching right now, how do they decide, oh, I'd be a really good candidate for this?
Yeah, I mean, if you're worried about, you know, falling in your balance, if you're suffering from numbness, tingling, burning, we offer a free consultation. So you could literally come into our offices, sit down with our providers, see our team, see how we get results. We do a quick preliminary test to see exactly, is this neuropathy, how bad is it, and is this something that we can help you with?
Greenville, Spartanburg, Malden, there's the phone number, but again, I guess we can come see you and sit down and talk to you.
Yeah, absolutely.
Got a baby coming?
Come check us out. Yeah.
Talk about that.
But before we go, Doc, I want to make sure that, because, you know, we have a lot of people that watch and they could be like, wait, let's those symptoms one more time. I may have one or more of those. So What are some of the symptoms
So
again?
numbness, tingling, burning, cramping. If you feel like loss of balance, if things just don't feel right in your hands or in your toes and your fingers, that's when you start to think you really need to get that thing diagnosed.
Yeah.
Get it diagnosed. Dr. Wilson, he is awesome. He's out and about in the community, staying fit. You probably see him in a CrossFit gym or two. So.
Try to.
Keeping the dream alive.
Well, Doc,
Yes.
thanks a lot
Yeah,
for
no
that.
problem.